Hi.
Hi,
You tell us your name?
my name is Alexandra.
Yeah. What brought you here to see Dr. Altman?
I actually had a arm injury about a year and a half ago, and I went to see a sports, I guess, surgeon, and he wanted to do surgery. But when I asked questions, what the surgery entailed, therapy, and he said it was going to be very, very painful. So I said no.
Okay.
So I kind of decided I was going to live with the pain until we heard about Dr. Briner about for my dad because he has issues with his sinuses and headaches and all. Then he had a problem with his shoulder. Then we heard about Dr. Altman through Dr. Briner. So here I am. I came in with a sling the first day I met Dr. Altman. So, and he came, he gave me the first treatment, my dad and I, and then we just been coming. And I suffer from GERD, IBS, UTI, and then asthma. That's the latest one. So, and Dr. Altman's been treating me, and I feel wonderful.
So
So I
the
started
what?
taking all the medication. Really, is what I've done. Yes.
Wow. So with the FSM,
Yes.
which you're hooked up to right now
Yes.
here. So you got all these different units putting frequency specific
Yes.
microcurrent into you.
So,
And so do you need the sling anymore?
no. No, and I just told Dr. Allman I have a chubby little chihuahua that pulled one day when I was trying to get him off the couch. I felt like a little pull, but I'm thinking, oh my God, my arm is going to be in. It disappeared the following day.
Wow.
I just put some ice on it. My arm didn't fall off. It's fine. It's wonderful. And I just told Dr. Allman to come in. I said, I feel 100% great. Like I have a lot of energy. I can sleep at night too because I wasn't able to sleep from the pain for a long, long time. And I'm not taking a leave anymore. I don't take anything, just natural like products, my vitamins, the standard process, and Shaklee, which is the two that I take.
That's
Pretty
great.
much is that's it.
So
And
what would you say to everyone who's got pain who may be thinking about surgery?
I would say come to Dr. Briner's medical center, see Dr. Ullman, see you, see Dr. Briner, and I think you guys are awesome. There should be more of you guys out there. There isn't really. And there's a lot of people like me walking around with a lot of pain, a lot of health issues. So I've been to every specialist since October. I've been sick since October. I came back from Ecuador, trip, got sick to my stomach. And they sent me to every specialist. I went to Griffin Hospital more than once in the ER. I went up to Yale, ended up there, and they said there's nothing wrong with you. But they keep giving me more medications. So, and then now it's on Trilogy and Albuterol and all this other stuff. And I'm no longer on any. I decided I was going to just stop taking everything, and I feel wonderful. I really do. You guys have helped me. I'm like so grateful. I appreciate it. Thank God I found out about it. And I found out about Dr. Briner and Dr. Ullman through my sister, and her husband is a homeopathic doctor in New York. And through a friend of theirs, also a healer, she almost died. And she was the one that told us about your dad, Dr. Briner. And
Wow.
he went right away and got Dr. Ullman. And here I am. I'm like, oh my God, it's only been 2 months. I've been sick for years. And doctors always said that I was fine. Nothing wrong with you. And I
Wow.
said, well, there is something wrong with me. You just guys haven't found it. So
Well, thank you.
thank you so much. Really
Absolutely.
appreciate it.
Thank you.
Hi, I'm Dr. Adam Briner. I'm here with Dr. Sean Altman, who we welcome to the practice. Dr. Altman is a doctor of physical therapy. And why don't you tell us a little bit about yourself to introduce you to everybody out there?
Sure. So I did my undergraduate work at Colgate, and I got my doctoral degree at Stony Brook University. From there, I've spent about 10 years in the field, working in various settings, from outpatient orthopedic, sports medicine, chronic pain, a lot of different areas. And through that, I've gained a valuable set of skills and ability to work with difficult and challenging patients of all types.
So, what would you say are the types of difficult patients or types of patients you're seeing? You're seeing everything from, you said, sports medicine to these chronically injured patients, right? Mm-hmm. So what types of techniques do you do that other physical therapists might not be doing?
So I would say that my approach differs from traditional physical therapy and really follows more of a naturopathic approach, which is looking for the root cause of a patient's symptoms rather than just diving into their specific diagnosis. So an example might be something like lower back pain. That's the medical diagnosis, but it doesn't tell us exactly where that back pain is coming from. And I typically spend my first 2 or 3 sessions determining the exact cause of the symptoms, how to address that, and any contributing factors that may be causing it to become chronic. And that's something I picked up on working with the chronic pain population, is there are often what we call contributing factors that are preventing this patient from getting better. And until those areas are addressed, this cycle of pain and disability tends to continue to repeat itself.
Great. So Dr. Altman does some pretty amazing stuff. He's not your typical physical therapist, and we encourage you to stop on by and say hi to Dr. Altman, make an appointment. We're going to also do some other quick videos describing certain conditions that he treats successfully. So until then, take care.